Thank you again for sharing. And on the top of your patients, I know you run your own private practice. Is there anything that you specialize in your private practice, whether that be like specific groups of people? I know you mentioned your upbringing, um, speaking Spanish only from a very young age, and that being the main language. So it could be people, it could be a certain orientation, but any specialties that you think that you have within your own private practice.
I, I tend to specialize in, work with evaluation and treatment of children and adolescents. Yet over the course of the last 5 years or so, what's kind of found me has been working with chronic pain patients. And so these are patients that have been injured in the work setting and are now in the workers' compensation system. And so they now comprise a significant part of my practice. And so, kind of in any given day, I think it's a blend of work with children and adolescents as well as injured patients or chronic pain patients.
Okay. Well, the last question I will have before Alice starts to ask some questions is when you say it found you, is there an inciting incident where that sort of changed for you, or did it just happen gradually over your time in private practice?
I know definitely kind of like a moment of of insight, if you will, that really solidified for me the decision to become a psychologist was um, at the time I was a year out of undergraduate. So it was my first year in the master's program in experimental psychology, and I was still questioning what to pursue, what to do thereafter, and what to pursue a PhD in. And I took a trip with my father that was clinical in nature. We went to Guatemala and Honduras to do clinical work with families that had lost their loved ones in a motor vehicle accident in this country. And so the work entailed evaluation and treatment of individuals that were grieving the loss of their loved ones. And during the course of that trip, I think working and oh, by the way, the trip was to the home countries of the families in Guatemala and Honduras, and um, I think things happened in that trip that just I would ascribe to the spiritual domain, and it in some way solidified for me that this was in a way my calling and what I was supposed to be doing, and to be able to help individuals that that needed it, especially those on the margins, those and I think in kind of in terms of those that and in my case, they tend to be individuals that are of Hispanic background, ethnic minority backgrounds, and so I know that that trip just did something in terms of really solidifying that this was the step that I needed to take. And, kind of getting off the plane after that trip, I really went full force towards the PhD programs in clinical and counseling psych. But to your original question, I don't think it was any one discrete event or thing. Rather, it just kind of almost kind of came full circle and sort of fell in the place where I'm supposed to be, which is what I find in private practice is that you kind of cycle through patients, you cycle through referrals, and the consolation is that what is your sweet spot, what is your center, if you will, kind of it kind of finds you, and so you tend to gravitate towards, I guess, maybe what you're comfortable with, what you're competent in, what you feel that you're helpful in. And I think that that happened both in terms of an orientation to the way in which I practice, an orientation into the way in which I teach, as well as an orientation to the kind of patient that I tend to have or tend to see.